And this is the complication which family members notice the most. Simple activities like dressing, bathing, having food, going.
What if I told you some of the biggest complications post stroke, spinal cord injury, any surgery, prolonged hospital stay, or ICU stay don't happen in the hospital? They start at home. And yes, we do celebrate the discharge of our loved ones, thinking the difficult part is over. But as a neurophysiotherapist, I have seen patients lose their week or even months of recovery just because no one warned them about what comes next. And the scariest part, many of these complications are completely preventable. Namaste. I'm Dr. Alisha, a neurophysiotherapist, and I welcome you all to another video from Sakshyam Physiotherapy and Rehab. In this video, let's understand what are the hidden complications that starts after hospital discharge and how to prevent them.
When a person stays in bed for days or weeks, the body starts changing itself faster than most people realize. Research shows that the prolonged period of inactivity can lead to muscle weakness, rapid muscle loss, poor balance, cardiovascular fitness loss, and increased dependency in the daily life activities. So, some patients even lose a significant amount of muscle mass and strength even during the first week of inactivity itself. So the question is not has the patient been discharged? The real question is has the rehabilitation started yet?
Let's look at the most common complications that we see post hospital stay. So, the first and the most common one is muscle weakness. So, doesn't matter if you are in the hospital after a stroke or a surgery or any ICU stay or any prolonged weakness. Inactivity always leads to muscle weakness, because of which the patients find it difficult to sit, stand, or walk. Another complication that we see is joint stiffness or contracture. So, when the patient's joints are not moved regularly, there is always a chance of the surrounding tissue, soft tissues, and muscles to become tight. And over the period of time, these can lead to restriction of movements, which is again difficult to treat. Then another complications that we see is even if the patient is feeling stronger and they're feeling better, but if the balance and coordination is compromised, then there is always a chance of fall and increased risk of injury at home.
Coming to the next complication is reduced lungs function. Shallow breathing, poor movement, and prolonged bed rest can lead to lesser chest expansion. And when the chest expansion is less, that builds up the secretion inside lungs, which can lead to various respiratory complications. The next complication is losing independence for the daily life activities. And this is the complication which family members notice the most. Simple activities like dressing, bathing, having food, going to bathroom and coming back, getting into bed and getting up, they suddenly require assistance and it's very difficult for them to do independently. The next
That is why rehabilitation should never wait. Physiotherapy helps bridge the gap between being medically stable and being truly independent. So, as a physiotherapist, we do assess and understand what all challenges a patient is likely to face during the process of recovery. So, accordingly, we design a physiotherapy protocol or rehabilitation protocol for the patient. At the same time, we do educate the caregiver and the family members so that they can also help the patient to recover in the best and safest way possible, because the goal here is not just recovery. The goal here is recovery without any setbacks. Having said that, the best way to manage a complication is to prevent it from happening in the first place itself.
Remember this, the body doesn't recover automatically after the hospitalization. It adapts to whatever you do next. If the movement is delayed, the complications will grow day by day. If the early rehab has started, that would accelerate the recovery. Hospital discharge is not the end point. For most of the patients, that is the starting point of recovery. Thank you for watching this video and keep following us for more physiotherapy and health related updates.